So hello everyone again. I would like to introduce you to one of my classmates, and we'll do this in quick order between each person. So David, the stage is yours. When you take the mic, I'll time you 2 minutes, and then I have to cut it at 2 minutes rudely. So it's on you.
All right, no problem. I don't think it'll go for that long. All right, so how's everybody going? My name is David. I'm a medical student in class with Morgan and Young-Hoon. So I just thought of a neat idea that I thought would be fun to work on if anyone is interested. So I was doing some shadowing in the ICU and talking to one of the consultants there at Mayo. They said that here in Minnesota, there's a problem where every year they have someone come into the ICU, several people actually, who have fallen through the ice at lakes because they walked out on thin ice. So I started thinking about how could we make a safety device that people would carry with them when they are going out, ice fishing or going out on lakes or going for hikes or what have you, that would help them get out of this kind of situation. Because the real problem with falling through the ice, especially if you were going on like the Mississippi River or something like that, where there's a flow to it, is that once you fall through the ice, the water may pull you away from where you actually fell through to where you can't go back up through the same hole that you came down into. And if anyone knows physics, I think the most important thing in this situation is every action has an equal and opposite reaction. So if you're trying to push up against the ice.
30-second warning.
Okay, so if you're trying to push up against the ice, you're not going to be able to because you have no grip. So I would like to come up with a device that you carry with you that preferably is attached to you maybe on your wrists that allows you to get a grip and maybe has some ability to help keep you in a good condition until you can escape. And if you'd like to hear more about it, come see me at the table.
You can share your video and mic now.
Yes, sir.
Venkat. All right, it's yours.
Hey, good morning, good evening, good afternoon, wherever you are. My name is Venkat Subbu. I'm here in Dallas, Texas. And my idea is simple, and I want you all to support me, and let's work on it. Let's think about Bob. Bob was the person that the first speaker introduced us to all. The senior gentleman who's got dementia, and he's living alone or in a nursing home. How do we vaccinate people like him? Either we got to take him to a vaccination site, so transportation, logistics, and all that. So how about UberVac? UberVac is the solution that takes the vaccine to the people in need, underserved, rural population, seniors. We cut down on carbon emission. We also save time and make sure the cold chain is safe. And for the two-dose vaccination, they don't have to travel anywhere. Just make sure they are available at home, and we are going to vaccinate them. This could be mass vaccination, mass immunization, and this could be done in apartment complexes and all that. Think about this, getting the pull and going to where the need is rather than making them drive all the way around town, waiting in lines and all that. So UberVac, come join me. Let's change the world. Thank you all. Have a great day.
Awesome. Hi, I'm Adam Glass. I'm a community paramedic with Advanced Care at Home. I also work on the ambulance ground side with Mayo Clinic Ambulance Service in Northwest Wisconsin. My quick down and dirty pitch, without having any business experience, is going to be a mobile application. What I think the problem is resource optimization. So what I mean by that is knowing where your resources are at all times. In the EMS world, we have a dispatch comm center that GPS tracks us. And the GPS is our dispatch is the central hub that dispatches us to all our calls when a 911 comes in. Now, there's a ton of applications out here for this, but because mobile integrated health and advanced care and home and even home health could be applied to this, is that, we don't have a way to really track you're part of the ambulance service. So our nurses aren't being tracked, our PAs, MPs aren't being tracked. And on top of that, we also have schedulers that might not know the geography of Wisconsin, or, don't take into account adverse weather for getting to the patient's home on time. Or you have two calls or visits, let's say one's 20 miles away from your other call. Well, are you the best option to go? If we create an app that shows you and geopoints the patient's home, as well as where all your service providers are, and we could even apply this to our third-party service providers when we run out of our own internal resources, then we might be able to optimize. Thank you. We might be able to optimize our workflows and be able to get to the patients in an efficient time, as well as eliminate a lot of miscommunication between all the different platforms we use right now, which includes Skype, Zoom, Epic Secure Chat, SharePoint, phone, email, etc. And that's what I got, creating an application to know where everyone is at the same time. That's just the MVP for the application, but I think it could go a lot farther than that.
Thank you, Adam. Thank you very much.
Perfect. Thank you so much. Hi. So I'm a medical innovation fellow and I'm a biomedical engineer up at Western University, just south of Toronto. I work with a lot of regional physicians and we develop a lot of different types of solutions to their problems. One sort of interesting one that I'm playing with right now was brought to me by a rehab physician nearby. He sees a lot of lower limb amputations, especially, and I know in the United States it's quite a large population, about 200,000 people every year, and most of these people have their amputation due to a bloodborne illness of some sort. And over half of these patients are going to develop wounds as a result of pressure sores in ill-fit sockets on their prosthesis. And so this raises sort of a few issues. First, these people are already prone to infection. And the other is like sort of the costs involved in continuous adjustment of these sockets. I think that sort of the underlying issue here comes with how we're measuring fit. We kind of do it as an N of 1 example, sort of in clinic. And I think that sort of ongoing monitoring of the fit is probably an important part of having the ergonomics of these devices work a little bit better for more patients. So I'd love to work with a team who can help me brainstorm some solutions. Maybe somebody who works in healthcare business who could understand how something like this might be adopted and paid for. And I'd like somebody to help me build a killer pitch deck and a value proposition around this.
Hi, my name is Xiang Fan, or you can call me Xavier. I'm an undergrad, biomedical engineering undergrad in UW Medicine. And the pitch I have here is that I emergency device, but this device is more like a device where you can take it. It can be used single-handedly, so it's like easier for you to actually like access it, and it's like more universal for you to use since it's single hand. And actually, I'm already drawing a picture of this device in SolidWorks. So the thing is that this device is going to be like a ring, and you have like a rotary knob on it. Rotary knob is for the purpose of not accidentally activated. So when you actually like twist it like this, like you twist the rotary knob, you can unlock the emergency button. Then you can just push it to like contact whoever you registered on a app that is connected to this ring. And also, so this is for active triggering this ring for emergency. There's also another way for you to use it, which is a passive way to trigger the emergency. So monitor some essential biostatus of yourself. For example, like your heart rate. So if your heart rate is really like high.
30 seconds.
Oh, okay. Sorry. It goes like really high or really low. It can trigger the alarm itself. So that is a passive way to trigger the alarm, and you have an active way to trigger it if the passive way is not. And once you trigger, you started the emergency, your essential BIOS can be sent to nearby hospital or to the app with someone you want to contact to. So it's just, yeah.
We've heard a lot of pitches today regarding home health, and from Dr. Chaudhry, a lot of awesome technologies that can kind of advance being able to get information sooner and in a screen in front of clinicians as they're treating patients, which is so important. With the pandemic, the spin that I come from is really more the business side of the world, working virtually, knowing a lot of people that all of a sudden have a limiting health condition, whether mental or physical. They have to go through the experience of figuring out how to try and work differently. They probably can't go to the normal 9 to 5. So I would like to elicit help coming up with some ideas of a digital platform that would basically allow, as a company, being able to take someone that maybe just got a cancer diagnosis or has to balance going to chemo, or maybe has to figure out chronic pain doesn't exactly have a name. They have to go through a journey. I have a company idea that I want to be able to have someone like that be able to not worry about trying to work differently. So I'm more from the HR space, the recruiting side of the world. I believe there's a lot of advancements already in that industry that very much complement some of the needs that I was hearing from different pitches today. I would appreciate someone with more of a data mindset and maybe more of a software background to really help understand of, eliciting people, kind of building this, and then helping kind of map out kind of a gig job portfolio.
30 seconds. 30 seconds.
What's the best way that this data could be honed in, organized, and ultimately I think there's a market for this kind of data down the road. There would be a lot of services that could be provided to help someone kind of balance their different life challenges, but I don't want work to be something someone has to worry about as they're figuring out their new world.
Thank you.
Thanks.
Thank you, Sarah. Thank you very much. That was excellent.
Hi, everyone. So my pitch today is about advanced care at home. So specifically for cancer patients, especially given such an immunocompromised population, I think so much can be done for the care providers, the caregivers. And I think just on the team, anyone maybe who's a cancer survivor, cancer patient, I'd be happy to hear from your experience, how we can make maybe scheduling your appointment better or the healthcare system for your care better. Thank you.
This time you only get 2 minutes, though. So I hope
yeah, thanks, Morgan. Yeah, I'll go really quick here. Look, I'm inspired by everybody. I love these pitches, and I just was thinking, my pitch is, I'd really like to see us figure out reciprocity at home, right? There's a lot of people out there that want to do things, but they just don't know how to help other people. And it's really reciprocity is, give when you can and take what you need, right? And I think it's really a cool concept that if we could form some logistics around the ability for people to have their gifts lean in and to help other people, even with disabilities and so on, there's just so much untapped, capable value and reciprocity in our communities that make it really hard when people aren't growing up in those communities for so long. So the pitch really is to figure out the logistics and the app for the ability for people to truly lean in and provide that purpose and that service and care to others, and at the same time be able to access that care and service of others in a true reciprocity, sort of a purpose-driven world. So I think it's just something that needs to happen given the shortages of our caregivers and care support staff in the country, as well as the cost. And that's my pitch, man. That's it.
So I have been looking at a lot of problems in Parkinson's and essential tremors. And the solutions that are there are either medication or very invasive neuromodulation type of solutions. Looking for something that is external and low cost that can be spread to the masses. So if anybody interested in solving Parkinson's and essential tremors, please come up with ideas.
Yeah, thanks, Morgan. I'm not gonna go over the slide deck up here, but basically what I did. So Nextern is one of our in-kind sponsors who has been very helpful in helping organize the event, provide mentors, etc. And they were willing to put forth a pitch for primary care telehealth. And in this PDF that I've uploaded, hopefully you can see it. Please let me know if you don't. But they outline a bunch of problem statements in preventative care. A lot of it has to do with screening methods, but there's a lot of valuable information I think participants could potentially get ideas from by reading through it. It's just a seven-page PDF. So if you want to skim it through, if perhaps none of the pitches so far have spoken to you, that resource is there. So yeah, that's just all I wanted to say.